Dr. Venturini here today, and we've been talking about the lumbar spine and the disc in particular. Last video we showed how when you bend forward or extend backwards, what the disc does. And so typically when we bend forward, that's when we get injured on the back side of the disc. Now, ways to correct it or to improve conditions if it is truly the disc, we're going to be doing a protocol through Mckenzie, who's kind of started it all. But it's an extension-based protocol where we're laying on our stomach and we're extending our spine and pushing down on the back side of the disc to help push the fluid towards the front side. So it looks like this. You're going to lay on your stomach, and you can do it pretty much anywhere. And what you're going to do is keep your hips in this area on the table and press up with your arms here, keeping your back and spine nice, relaxed. So I'm going into extension. You can hold for a bit and come back down, okay? And you go to whatever range you can get to, right to where you start to feel that resistance or pain. And back down. And it gets a little easier each time. Maybe you can get all the way up like this, and down, and up. So it's just repeating this motion as so. And you can do between, 10 to 15 reps as a set, and just kind of see how you do with one set. If it's feeling fine or it's not bothering you, you could do a couple more sets. You're just going to do that periodically throughout the day. Now, signs of improvement would be either decrease in pain, or the pain, if it's diffuse and kind of all over the place in your legs, if that pain starts to centralize or come towards the spine into a center point, that's a good sign. If things that would be worse would be if that pain starts to go further down the legs and basically peripheralization instead of centralization. So that's something to look out for. Again, these are just tools to try. We're not, unless you get assessed by a professional and you're under direct care, these are things that you can try at your own risk, essentially. But give that a try. That's going to help with the disc and potentially help your lower back pain.